Meanwhile, the Wuhan virus is on a rampage in India. Every day is a grim record. More than 200,000 new cases were reported in the last 24 hours. And this has never happened anywhere in the world. 200,000 cases in just 24 hours, 2 lakh cases. Mini lockdowns have returned. There's a weekend curfew in the national capital now. Every time you open your phone, there's probably some news about the pandemic. But not all of it is accurate. Clear messaging is important right now, and we are trying to do our bit. We are going to answer 5 key questions about the pandemic. Number 1, why are cases rising? Is it all because of the mutants? Number 2, do our vaccines still work? Do they work against the mutants? Question number 3, why are vaccinated people getting the virus? Number 4, are kids safe? Because remember, they are the last in the line for the vaccine. And number 5, what happens if you test negative but still show symptoms? Let's take these questions one by one. Why are cases rising? Are mutants to blame for the second wave? Yes. We say yes, but we also add most probably, and I'll explain why. India has reported something called a double mutation. Here's how it works. You have a virus that has already mutated, like the UK variant or the Brazil variant. Now, when this mutation undergoes another level of change, it becomes a double mutation. And these variants, double mutants, are highly infectious. They can even evade antibodies. And they're most likely causing the surge. And we say most likely because to be completely sure, we need more data. Genome sequencing is the only way we can identify mutants, but India's genome testing numbers are dismal. From January to March, less than 1% of the samples were tested, and that's simply not enough to draw trends. Question number 2, will the vaccines still work? Are they effective against these new variants? In theory, they should be, but experts are warning of reduced effectiveness. Both Johnson & Johnson and Novavax revealed this trend in their phase 3 trials. They neutralized the UK variant, but they were not as effective against the Brazil and South African variant. So vaccines may not work as effectively as earlier. But remember, less effective is not the same as not effective. You'll still be better off with a vaccine. Which brings us to our third question. Why are people getting the virus even after vaccination? And now listen to this carefully. Vaccines are not intended to prevent infection. What they will do is prepare you better. They will ensure that you do not have severe symptoms or end up in hospital. This is the case for most vaccines in the market. They're intended to keep you alive, not make you invincible. So the next time you hear such reports, remember the vaccines are not failing. They're doing exactly what they were meant to do. Question number 4, what about children? Are they at risk, and how much? The first wave saw older people with comorbidities being more susceptible to infection. But that's not the case now. There are more young people in ICUs than older patients in Brazil, for instance. Where does that leave children? They're the last in line to get the vaccines. But on the front lines of this new outbreak, look at this data from March to April 10th. More than 60,000 kids were infected in the state of Maharashtra, 6,000 in Chhattisgarh, 7,000 in Karnataka, and 3,000 in Uttar Pradesh. The second wave is infecting more children. We spoke to Dr. Dana Hawkinson about this emerging trend. He's an infectious disease expert from the University of Kansas. Listen to what he had to say.
I think it's a combination of different things. I think, number one, we know that more adults have been able to get vaccinated. I think that helps. We also know that a lot of adults who are out doing the normal things that they were doing have probably already had COVID-19. We know that in a lot of places as well, schools have reopened. And I don't think it's specifically the schools, but I think it's the chance that the kids have more opportunity to get together either in functions like athletics or just get together outside of the school themselves and have those interactions. So I think it's much easier to spread that way. In addition, initially it was thought children don't get the disease and don't spread it. That actually is not true. And I think we're just seeing more evidence of that now for those reasons that I just discussed.
So the trend is worrying, but it appears natural. The same rules that apply to you apply to your kids. Mask and social distancing, so playtime with mates will have to wait. Now, question number 5. What if you test negative but have all the classic symptoms? And this is a tough one. This is happening with a lot of people. False negatives are a real scare. Why are they happening? Because the virus has changed, but your test has not changed with it. The normal RT-PCR test that you get done is still looking for the old virus, and you're being sent packing with a negative result. If you don't start treatment, your infection might worsen. So what do? When in doubt, stay home. Quarantine yourself like a normal Wuhan virus patient. Speak to your doctor, treat the symptoms. They may prescribe more tests or use other indicators to diagnose you. But do not leave home until you're all clear. And we understand it's not an easy situation to be in. The virus is throwing new challenges every day. Our health apparatus and our experts are all struggling to keep pace. India's situation, it seems, is worse than last year. You can do your bit by either adding to the caseload or breaking the chain. So keep the mask on. Also stop the infodemic. We are bringing back our message from last year. Contribute positively to the information flow. Do not rely on social media forwards. With all these mutants and false negatives, this is not the time to play doctor. It's the time to listen to one. WION is now available in your country. Download the app now and get all the news on the move.